Hey, Tim Reha here live at the Digital Health Summit, San Diego. So we got Chris Holbert, he's the CEO of SecuraTrac.
How you doing?
So Chris, really cool to see the Consumer Electronics Show and see a lot of sensors and really innovations with Bluetooth, low-powered sensors. And I wanted to hear about your background.
Yeah, so my background, and actually most of the folks who work at SecuraTrac, is a pure IT technology background. We take IT and make it relevant for business. The way we got started in SecuraTrac now, just over 5 years ago, was that we wanted to bring solutions to families and businesses that would allow businesses to protect employees in dangerous situations and for families to really become more aware of the safety of seniors as well as children in the home.
You're working on, you thought about this for a long time ago before the technology was even here.
Yeah, that's right. You know, about 24 years ago in college, we ran a program for single-parent families for children. We did tutoring and mentoring programs after school, and one of the things we thought would always be great is if when the child arrived at school, the aftercare program, that they could automatically notify the parent that they were there safely, and when they left and made it home afterwards, that they made it home safely. And technology just wasn't there that time, and about 2005 we looked back into it, found that it was, and in 2008 we launched the company.
So a lot of really cool things happen and get launched, and we get to see some new things at the Digital Health Summit. We just saw WellDoc with their new release. What do you got here?
So what we do, we have mobile health and mobile safety technology. It's a combination of a couple things. This patch that you'll wear on your body, it senses everything from heart rate to body temperature and a number of other vitals in between. And then it relays using Bluetooth low energy, that signal, to a device like this one, which is also a GPS location device. So that then the combination of this on your body and this worn will tell us where you are and also how you're feeling. What we do is we generate a number of automated or personalized notifications that can be delivered in any number of ways to 24/7 monitoring centers. And it's often used to protect lone workers in high dangerous situations such as oil and gas, petrochemical, as well as in the healthcare space, maybe mobile and home healthcare workers, as well as their patients. And then also emergency response, so seniors aging in place at home.
Yeah. As I said, last cycle we had our friends at ARP sponsored the whole show. We want to thank you guys for that. And aging in place, this is an enabling technology for doing that.
Absolutely. So if you take a device like this one's easily worn with a lanyard around your neck. It's 2 ounces. It works in over 120 countries using 3G to communicate and relay information about your health as well as about your safety. You can trigger an alarm just by pushing and holding this button, or we can sense based on environmental sensors that are built into this device, or again by other sensors that are used in this one worn on the body, that we may need to contact you. So there's a two-way communications capability with this device. Speakerphone, essentially, high-powered speakerphone, works from 10 feet away. So it's very easy for people to communicate hands-free and without any action whatsoever. Auto answering, things of that nature are available. So this becomes a very easy to use, very actionable oriented solution for seniors, for lone workers, and people in the healthcare industries.
What are you seeing in the future? We see Bluetooth coming out with new low power platforms for moving data around. What else is going on in the sensor space?
You know, there's so much, but there's a lot of near field communications and or Bluetooth low energy that gets you anywhere between 2 and 35 feet of communication between things like hubs. And so hubs could be anything from a device like this that's mobile, or a hub could be something that you plug into a socket inside a home or a nursing facility that will then take that information about the environment and about the person or the people, relay it to a platform like the one that SecuraTrac has, and then determine what best course of action to take, whether it's medication, whether it's doctor response, or whether it's an emergency plan of some kind.
What types of folks are you trying to meet here?
You know, SecuraTrac builds its business based off of building solutions and selling through channel partners. We get a lot of leverage from a few number of employees because we partner with leaders in space, again, in healthcare space, lone worker safety, as well as in the emergency response industry. So we're looking to partner with businesses who sell direct to consumers, as well as other platform providers that sell into businesses that sell into consumer space.
Awesome. Well, really cool to hear your story, Chris, and thanks for being part of the Digital Health family here.
Thank you for having me. I appreciate it.